Welcome back from lunch, everyone. Before we get started with our executive provider panel, we have a couple of awards that we are delighted to share with everyone today. We just want to take a few minutes to recognize two brilliant gentlemen with awards as their contributions over the past decade have brought actionable price transparency to us all. It's my honor it's my honor to bestow to Chapin White Leadership Award. Many of you know who Chapin is. I first got to know Chapin know of Chapin's work back in 2015 as he published an article in Health Affairs. Excuse me, just 1 second here. I was having a little bit of a computer glitch. So there we go. So in 2015, when he began considering in 2015, when David Kelleher and I began considering how we wanted to approach addressing fair health prices in Indiana. We had several employers that had a national footprint come up to us and say, the prices in Indiana seem really high. We wanted to figure out, are they really high and how might we benchmark ourselves? So in our readings, we came across an article that Chapin had written in the December issue of 2015, where he had a graph that really, and I have it here in my office all the time because it really did change the course of how we are purchasing healthcare. But he had a graph where he noted what Medicare trend was over time, or prices for Medicare over time, over 15 years, and then what commercial was over that 15-year period. And that line graph looked very different. And Shane actually shared that graph with us earlier. While he's widely published, when we were looking to see, is there any information that's already been published about Indiana or any other states regarding price transparency, it was clear that, there really wasn't a lot out there. We found one article. It was written by Chapin using 2011 data, and he had claims data from the three big auto companies in Detroit, and he looked at 13 cities to see what their prices were relative to Medicare. And Indiana had two of the highest cities. We were number 1 and 2 for outpatient, and we were numbers 2 and 3 for inpatient services. So that gave us some inclination that we may have a problem here. So one day, Dave Kelleher, who is the forum's founder, and you'll hear more about him later on in the presentation. One day we were just having coffee and kind of geeking out over Chapin's 2015 Health Affairs article. And we had this idea, since he had the ability to look at commercial prices at a city level, might he be able to do that at a hospital level? We cold called him one day and shared with him our high level idea. And had he said to us, that's a dumb idea, that's really not feasible, none of us would be here today and none of this work would have transpired. We would have probably said, he's a subject matter expert, nationally recognized in the country, and just moved on from there. That's not what he said. He actually said, in a really warm way, that's exactly what needs to happen, and I'd be happy to help you figure this space out if you'd be interested. We were definitely interested and honored that he would consider partnering with us to do this research and analyze employer claims data. He came with a heavy price tag, and I can't say it's necessarily him. I know he wouldn't do that to us now that I know him better, but research is expensive, especially when you're partnering with Rand Corporation. Thankfully, Kathy Hempstead at the Robert Wood Johnson Foundation, who had worked with Chapin before, funded all of the RAND 1.0, 2.0, and 3.0 studies. We did have employers contribute financially somewhat, only if they wanted a private report of their own population. So thank you to Kathy, and thank you to Chapin as well. So a little bit about Chapin. Many of you may know that he received his PhD from Harvard in 2005. He was then principal analyst at the Congressional Budget Office from 2005 to 2010. Thereafter, he was a senior health researcher at the Center for Study Health System Change for the following 3 years. And then he was at RAND Corporation from 2013 to 2020. Since January of this year, he's Deputy Director of the Health, Retirement, and Long-Term Analysis Division at the Congressional Budget Office. So he's somewhat back to where he started at after his PhD, but in a much more senior role. So we are delighted to award Chapin this Innovation Award, because what he has done is he's taken this innovative approach to analyzing and presenting complex price data. And that is really his gift to all of us, is just making price transparency not just available, but understandable. Chapin, I wish you were here so I could give you a big hug and congratulate you, but thank you so much. And I look forward to seeing you soon. Sarah? So that was supposed to be clapping that you were hearing there, and this is the award that we got for Chapin. It's inscribed as noting the Healthcare Innovation Award, and we will mail this out to you. So thank you again. We have one other award, and I'll turn it over to Kristen Royer to share with you, talk to you more about that. Thank you.
Great, thank you, Gloria. Our next award is a leadership award, and I am excited to be able to give this award to Dave Kelleher. I think Dave is on with us today, and many of you know Dave, but if you don't, you know that he's devoted most of his professional life to the healthcare industry. He's managed many healthcare organizations after he completed his military service in 1972. And I've known Dave for probably a decade or more, and he has just been amazing to work with. His career is one that is just, it goes across the country. He knows so many people. He was one of the founders of the first prepaid group practice in Indiana, and served as the executive vice president from 1973 to 1986. He founded Healthcare Options in 1986 and served as president. Healthcare Options developed and managed healthcare medical groups, hospitals, academic medical centers, and employers in 38 states over 4 decades. And I got to know Dave by working with the Employers Forum, which he founded in 2001 and also managed until 2015 when he retired. So I think now he gets to, go play a little bit more, but his passion around cost and quality is just, he's just one of the great individuals leading those efforts. And that also led him to become one of the first organizers of Quality Health First of Indiana, which was a statewide multi-payer quality reporting and pay for performance program that was also managed by Indiana Health Information Exchange, or IHI. So as I mentioned earlier, Dave retired in 2015, but we refer to it as his semi-retirement. He's played an active role in the Employers Forum. He continues to be involved with the RAND studies. He speaks to many groups about hospital price transparency, and his leadership dedication around working with and educating employers and driving change, especially in the healthcare space, is just unmatched. He's extremely passionate about it. So he is more than deserving. And probably my speech doesn't even do justice, but he's more than deserving than our first Employers Forum Leadership Award. And we'd also like to name this inaugural Leadership Award after him for future years. So we are so thankful and lucky that Dave continues to share his wisdom, experience, and knowledge by serving on our Employers Forum board and working on all of our initiatives. Without him, we would not be where we are today. Congratulations, Dave. I'm personally thankful to know you as a colleague and a friend, and especially for all that you've taught me over the last decade. So congratulations to Dave. And this is the award we'll be sending to Dave. I think he is actually enjoying some time away out of state right now. So we'll make sure he gets this award, and we really, really appreciate Dave and all the work he does with the forum.